Greetings to all. My name is Nadhratul Safiyyah Binti Azizin from Safiyyah University. We have conducted a research entitled An Assessment of Relationship Between Biomaxillary Vital Structures for Safe Treatment Procedure. These are our contents. Let me start with introduction. A proper clinical assessment prior to dental procedure is very essential in order to ensure a successful outcome. Knowledge of the maxillary sinus, mental foramen, and inferior alveolar canal position is very crucial to avoid any injuries or damages during the dental procedure. Therefore, clinicians need to be more attentive of the presence and position of this vital structure. The aim of this study was to measure and evaluate the presence and distance among dentition and vital structure of the biomaxillary jaw for safe treatment planning. For objective, it was to compare the relationship of root apices to the maxillary sinus, anterior lobe, mental foramen, and inferior alveolar nerve between males and females. Moving on to the methodology. First, the study design was analytical cross-sectional study. Secondly, the study protocol accepted by Safiyyah University Ethical Committee. For participants, it involved 16 patients visited Safiyyah Oral Health Center. Next, instruments used in conducting the study were CBCT and Blue Sky Plan 4. Fifth, CBCT images were analyzed for data collection. And lastly, analysis were done using SPSS Statistic Window 22.0 version. Let's look at the inclusion and exclusion criteria. Patients must be within 21 to 50 years of age. All maxillary and mandibular positive must be presence of at least one quadrant, and there should be absence of any pathological abnormalities concerning any vital structures. And for exclusion criteria is the complete opposite of our inclusion criteria. Now, this picture here showed how we measured the distance between apex of maxillary first molar and maxillary sinus. Next picture is how we measured the distance between maxillary sinus. This showed distance between right and left anterior lobe. This is how we measured distance between apex of mandibular second premolar and mental foramen. And lastly, this is how we measured the distance between apex of mandibular second molar to the mandibular canal. Now, we have come to the results and data analysis. We have chosen our p-value to be p less than 0.05. Determination of mean distance from maxillary sinus to root apices revealed shortest distance was 0.1 mm from 1/6 in right side, while for left side it was 1/7 with 0.2 mm distance. This graph showed distance between right and left maxillary sinus. 93.75% showed presence of anterior lobe, with mean distance of 41.25 mm in males and 38.95 mm in females. Mean distance between mental foramen was 49.1 mm. In relation to mental foramen position, it was mostly found towards apex of first premolar for both genders, with highest percentage of 100% in females on the left side. Lastly, results showed closest tooth to mandibular canal was third molars for both males and females. Moving on to the discussion. Our study documented the closest tooth to maxillary sinus was first molar with highest percentage of 50% in males. It is imperative to know proximity of root apices to the maxillary sinus floor to avoid any errors during dental procedures such as perforation during extraction, oral fistula formation during endodontic surgery, or also root resorption in orthodontic treatment due to perforation of root to the sinus. These results should be able to give dentists an idea on which maxillary positive they should be extra careful when doing dental procedure. For extent of maxillary sinus, highest percentage should extend to canine in right side. For left side, it was first premolar. In discussion of extent of maxillary sinus and distance between them for all on 4 implant case, 2 posterior implants are placed at an angle position, but we believe that with more information and research on the distance between maxillary sinus will allow implant to be placed safely while avoiding perforation of the sinus. Now, moving on to the next discussion. Another study on Malaysian conducted by Wong et al. Also reported 94% of anterior lobe presence out of 100 participants. Identification of anterior lobe and distance between them important in relation of mandibular implant placement in interforaminal area in which we could determine the most distal point for implant placement, locate a 2 mm zone of safety distance, as well as to prevent damages to anterior lobe that could lead to the disturbance of lower lip sensory. Our study revealed that mental foramen located towards first premolar in both genders, which is in contrast to other study done on Malaysian, in which second premolar reported to be in line with mental foramen. The difference may be due to changes with ages, alveolar bone loss, missing tooth, and difference in racial group. Mental foramen is a critical landmark in conducting procedures such as implant surgery, mandibular osteotomy, and chin block graft. This picture showed chin block graft harvesting procedure, in which vertical cuts should be at least 5 mm away from the mental foramen. Last part of the discussion, it is on the closest tooth to mandibular canal, in which our study revealed third molar as the closest tooth for both sides and gender. Knowledge of inferior alveolar nerve position is essential in avoiding nerve damages during dental procedure. As we can see from the picture, our filling of endodontic cilia into mandibular canal could lead to paresthesia of inferior alveolar nerve. Our result was important as it could give an idea of which tooth should be given more consideration during extraction, implant placement, or even during endodontic treatment to reduce chances of injury to inferior alveolar nerve. Injury to inferior alveolar nerve could lead to complications that may be permanent or last more than 6 months, in which it can range from mild hypoesthesia, complete anesthesia, as well as neuropathic response that could resulting in chronic pain. Now we have come to the conclusion. In conclusion, all 5 objectives has been fulfilled. Knowledge of the anatomical relationship of the maxillary sinus, mental foramen, and IAN is essential for preoperative treatment planning to prevent an iatrogenicity and minimize the risk of complications. Second, identifying the closest tooth to the maxillary sinus is critical to emphasize the need for dental practitioners to be extra cautious during dental procedures. We have come to know that a high prevalence of anterior lobe was found among patients in Segi Dental Clinic. Mental foramen was found in both the right and left quadrant in all patients, and the most common mental foramen position in patients who visited Segi Oral Health Center was toward the apex of the first premolar. Lastly, the possibility of damage to the IAN is higher in cases involving mandibular third molar. With that, we have come to the end of my presentation. These are our references. I would like to thank all of you for your attentive and patient listening. Thank you.